Welcome to Medical Assistant Practice Test 2026 or 2027, 100 questions with explained answer. Let's begin. Question 1. Medicare Part A. Here are your options. Option A covers inpatient care. Option B covers outpatient care. Option C is voluntary and pays 80% by Medicare and 20% by the patient. Option D allows participants to choose managed care plans. The correct answer is option A, covers inpatient care. Explanation. Medicare Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. It is generally premium-free for those who have paid Medicare taxes while working. Question 2. When reading the CPT manual, a triangle next to a code notes. Here are your options. Option A, a new procedure. Option B, revised code description. Option C, add-on codes. Option D, codes that are not to be used with modifier -51. The correct answer is option B, revised code description. Explanation. In the current procedural terminology, CPT, manual, a triangle symbol placed next to a code indicates that the description for that code has been revised or changed from the previous edition. Question 3. When considering coding for hospital stays, a underscore is used to provide physicians with guidelines for admission and length of hospital stays. Here are your options. Option A, Diagnosis-Related Group DRG. Option B, Healthcare Financing Administration Common Procedural Coding System HCPCS. Option C, Relative Value Study RVs. Option D, ENV codes. The correct answer is option A, Diagnosis-Related Group DRG. Explanation. A diagnosis-related group, DRG, is a statistical system of classifying any inpatient stay into groups for the purposes of payment. It provides guidelines for the expected length of stay and resources used for specific diagnoses. Question 4. Where would your office obtain additional legal copies of Medicare forms? Here are your options. Option A, from an agency listed in the Medicare Fiscal Agencies Directory. Option B, Internal Revenue Service. Option C, Centers for Disease Control. Option D, a local campus office. The correct answer is option A, from an agency listed in the Medicare Fiscal Agencies Directory. Explanation. Official Medicare forms and documents should be obtained through authorized channels, specifically the agencies or contractors listed in the Medicare Fiscal Agency Directory that manage regional claims and administration. Question 5. Which of the following is not considered an asset? Here are your options. Option A, money. Option B, bank debts. Option C, medical and office equipment. Option D, land, buildings, furniture. The correct answer is option B, bank debts. Explanation. In accounting, assets are resources owned by a business that have economic value. Bank debts are considered liabilities because they represent money that the office owes to others rather than something it owns. Question 6. A physician asks a medical assistant to run to the store to get stickers to give to children who come into the office for medical care. How should the medical assistant pay for the stickers? Here are your options. Option A, the accounts receivable. Option B, petty cash. Option C, accounts payable. Option D, personal check. The correct answer is option B, petty cash. Explanation. Petty cash is a small amount of discretionary funds in the form of cash used for expenditures where it is not sensible to make any disbursement by check, such as small office supplies or miscellaneous items like stickers. Question 7. A doctor's office recently bought new waiting room furniture and financed the purchase. From the perspective of the doctor's office, what is the nature of the debt owed to the vendor? Here are your options. Option A, asset. Option B, account receivable. Option C, account payable. Option D, owner's equity. The correct answer is option C, account payable. Explanation. An account payable is an obligation to pay a short-term debt to a vendor or supplier. Since the furniture was financed and the money is still owed, it is recorded as a liability in the form of an account payable. Question 8. IRS Form W-2 refers to. Here are your options. Option A. Request for Federal Tax Identification Number. Option B. Social Security Number Application Form. Option C. Wages and Tax Statement. Option D. Federal Unemployment Tax Return. The correct answer is option C. Wages and Tax Statement. Explanation. The Internal Revenue Service, IRS, Form W-2 is the wage and tax statement used to report wages paid to employees and the taxes withheld from them during the calendar year. Question 9. The government agency that regulates Medicaid and Medicare. Here are your options. Option A. HCFA. Option B. CPT. Option C. CIC. Option D. OSHA. The correct answer is option A. HCFA. Explanation. The Healthcare Financing Administration, HCFA, was the former name of the agency now known as the Centers for Medicare and Medicaid Services, CMS. It is responsible for overseeing these federal healthcare programs. Question 10. What coding system is used to code for procedures and medical services provided by the practitioner? Here are your options. Option A. ICD-10. Option B. HCPCS. Option C. CPT. Option D. FDA. The correct answer is option C. CPT. Explanation. The current procedural terminology, CPT, coding system is a set of codes, descriptions, and guidelines intended to describe procedures and services performed by physicians and other healthcare providers. Question 11. A patient was brought to the emergency room because of slurring of speech and weakness of the right arm 6 hours after the patient feels normal. What is the condition of this patient? Here are your options. Option A. Stroke. Option B. TIA. Option C. A myocardial infarction. Option D. Subacoid hemorrhage. The correct answer is option B. TIA. Explanation. A transient ischemic attack, TIA, is a temporary period of symptoms similar to those of a stroke. A TIA usually lasts only a few minutes and normally does not cause permanent damage, with symptoms typically resolving within 24 hours. Question 12. A patient presents with a rapid and weak pulse, shallow breathing, hypotension, and cold and clammy skin from a gunshot wound. What is the condition of this patient? Here are your options. Option A. Hemorrhage. Option B. Shock. Option C. Stroke. Option D. Heart attack. The correct answer is option B. Shock. Explanation. Shock is a critical condition brought on by a sudden drop in blood flow through the body. Symptoms like rapid weak pulse, low blood pressure, and cold clammy skin are classic indicators of circulatory collapse, often following trauma. Question 13. A 55-year-old male patient presents with symptoms of diaphoresis and chest pain for more than 30 minutes, not relieved by analgesics. What condition should be suspected in this patient? Here are your options. Option A. Pneumonia. Option B. Stroke. Option C. A myocardial infarction. Option D. Pneumothorax. The correct answer is option C. A myocardial infarction. Explanation. A myocardial infarction, or heart attack, is characterized by persistent chest pain, often accompanied by sweating, diaphoresis. Pain that lasts longer than 30 minutes and is not relieved by rest or standard analgesics is highly suspicious for a heart attack. Question 14. The doctor ordered the medical assistant to apply rice to the patient with a sprain. Which of the following is not a rice application? Here are your options. Option A. Rest the injured part. Option B. Put ice on the affected areas. Option C. Conditioning. Option D. Elevate the affected area. The correct answer is option C. Conditioning. Explanation. The acronym RICE stands for rest, ice, compression, and elevation. These are the 4 essential steps for treating soft tissue injuries like sprains. Conditioning is a training process and not part of the acute injury treatment. Question 15. A patient was brought to the clinic because of a burn on the right hand. The site has blistered red appearance with edema. What is the classification of the patient's burn? Here are your options. Option A. Superficial. Option B. Partial thickness. Option C. Full thickness. Option D. 3rd degree. The correct answer is option B. Partial thickness. Explanation. Partial thickness burns, also known as second-degree burns, affect the epidermis and the dermis. They are characterized by redness, pain, swelling, edema, and the presence of blisters. Question 16. A 65-year-old female was brought to the emergency room because of high fever, hypotension, tachypnea, and cold, clammy skin. The patient has severe pneumonia. What type of shock does the patient have? Here are your options. Option A, septic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option A, septic shock. Explanation. Septic shock is a severe form of sepsis that causes a dangerous drop in blood pressure and organ dysfunction. It is often triggered by a systemic infection, such as severe pneumonia, and presents with fever and low blood pressure. Question 17. A 28-year-old man cut himself with a knife while slicing a rack of ribs. To control the patient's hemorrhage, the initial step is to. Here are your options. Option A, apply a tourniquet below the site. Option B, immobilize the part. Option C, apply direct pressure. Option D, give topical antibiotic. The correct answer is option C, apply direct pressure. Explanation. The first and most effective step in controlling external bleeding is to apply direct pressure over the wound using a clean dressing or cloth to encourage clotting and slow blood loss. Question 18. Why is the review of systems important for the health practitioner? Here are your options. Option A, to know the reason why the patient visited the doctor. Option B, to uncover other health issues of the patient that were not mentioned in the other parts of the history. Option C, to screen cancer and genetic problems. Option D, to address the lifestyle of the patient. The correct answer is option B, to uncover other health issues of the patient that were not mentioned in the other parts of the history. Explanation. The review of systems, ROS, is a systematic technique used by healthcare providers to identify any symptoms or health problems the patient might have missed or failed to mention during the chief complaint or history of present illness. Question 19. When the patient complains of abdominal pain, how will you know what organ is most likely affected? Here are your options. Option A. Divide the abdomen into 4 sections and ask the patient in which section the pain is. Option B. Ask the patient how severe the pain is. Option C. Ask the patient when did the pain start. Option D. Divide the abdomen into upper and lower quadrant and ask if the pain is upper or lower. The correct answer is option A. Divide the abdomen into 4 sections and ask the patient in which section the pain is. Explanation. Healthcare providers divide the abdomen into 4 quadrants, right upper, right lower, and left lower, to help localize symptoms and determine which underlying organs may be involved in the patient's pain. Question 20. A patient, a 17-year-old female, is complaining of palpitation and fast heartbeat. The patient has a history of panic attacks and anxiety. To determine if she has tachycardia, the medical assistant decided to use her thumb to count the pulse. Is this recommended to determine pulse? Here are your options. Option A. No, the thumb has its own pulse. Option B. No, the skin of the thumb is too sensitive. Option C. No, the skin of the thumb is not sensitive enough. Option D. Yes, it is recommended to use the thumb to take a pulse. The correct answer is option A. No, the thumb has its own pulse. Explanation. Using the thumb to take a pulse is not recommended because the thumb has its own strong arterial pulse. This can lead to the medical assistant counting their own pulse instead of the patient's. Question 21. The following are included in the rules on charting except. Here are your options. Option A. Check carefully the name on the chart. Option B. Chart in pencil. Option C. Do not chart assumptions. Option D. Date each entry and sign with your complete name and title. The correct answer is option B. Chart in pencil. Explanation. Medical records are legal documents. All entries must be made in permanent ink, usually black, to ensure they cannot be erased or altered. Charting in pencil is never acceptable in professional practice. Question 22. A sphygmomanometer is used to. Here are your options. Option A. Check for heart disease. Option B. Check blood pressure. Option C. Check for pulse. Option D. Check for vital signs. The correct answer is option B. Check blood pressure. Explanation. A sphygmomanometer is an instrument used specifically to measure blood pressure. It consists of an inflatable cuff, a measuring unit, mercury manometer or aneroid gauge, and a mechanism for inflation. Question 23. What term is used when all microorganisms including the spores in an instrument have been eliminated? Here are your options. Option A. Sterile. Option B. Asepsis. Option C. Sanitized. Option D. Disinfected. The correct answer is option A. Sterile. Explanation. Sterilization is the process of destroying all forms of microbial life, including highly resistant bacterial spores. Once an instrument has undergone this process, it is considered sterile. Question 24. What is the position that produces the most accurate blood pressure determination? Here are your options. Option A. Have the patient in a sitting position with an arm extended at heart level. Option B. Have the patient in a standing position and arm curled up. Option C. Have the patient lying down with palms in a down position. Option D. Have the patient sitting with an arm extended above the heart. The correct answer is option A. Have the patient in a sitting position with an arm extended at heart level. Explanation. To obtain an accurate blood pressure reading, the patient should be seated comfortably with the arm supported at the level of the heart. Having the arm too high or too low can cause false variations in the measurement. Question 25. Red-marked glass thermometers are used to take what temperature? Here are your options. Option A. Axillary. Option B. Rectal. Option C. Tympanic membrane. Option D. Oral. The correct answer is option B. Rectal. Explanation. In clinical settings, glass thermometers are color-coded for safety. Red-tipped thermometers are used for rectal temperatures, while blue-tipped ones are used for oral or axillary temperatures to prevent cross-contamination. Question 26. A medical assistant cleaned a patient's wound using forceps. She then soaked the forceps in alcohol. Which aseptic technique did she use? Here are your options. Option A. Sterilization. Option B. Autoclaving. Option C. Sanitization. Option D. Disinfection. The correct answer is option D. Disinfection. Explanation. Disinfection is the process of using chemicals, such as alcohol, to destroy or inhibit the growth of pathogenic microorganisms on inanimate objects. It is less effective than sterilization because it may not kill all spores. Question 27. A physician is about to give a pap smear procedure to a patient. As a medical assistant, you assist the patient and help her get into position for the procedure. What position should you put her in? Here are your options. Option A. Horizontal recumbent. Option B. Lateral Sims. Option C. Fowler's. Option D. Lithotomy. The correct answer is option D. Lithotomy. Explanation. The lithotomy position, where the patient lies on her back with feet in stirrups and knees flexed, is the standard position for gynecological examinations and procedures like a pap smear. Question 28. A wound where tissue is not just separated but torn away from the body is referred to as. Here are your options. Option A. Laceration. Option B. Avulsion. Option C. Abrasion. Option D. Gangrene. The correct answer is option B. Avulsion. Explanation. An avulsion is a type of injury in which a body structure is forcibly detached from its normal point of insertion by either trauma or surgery. It involves the tearing away of skin or tissue. Question 29. Michael, a 5-year-old boy, has been complaining of itchiness, rash and irritation around the anal area. He was brought to the clinic by his mother and to her surprise the doctor performed a Scotch tape test. This test is used to diagnose infestation of which parasite? Here are your options. Option A. Mosquitoes. Option B. Fungus. Option C. Roundworms. Option D. Pinworms. The correct answer is option D. Pinworms. Explanation. The Scotch tape test is the standard diagnostic method for pinworms. Pinworms migrate out of the anus at night to lay eggs. The tape is used to collect these eggs from the perianal skin for microscopic identification. Question 30. Round-shaped bacteria that are seen in pairs are called. Here are your options. Option A, Streptococcus. Option B, Diplococcus. Option C, Staphylococcus. Option D, Bacillus. The correct answer is option B, Diplococcus. Explanation. The prefix diplo- means double or two. Diplococci are spherical or round-shaped bacteria, cocci, that typically occur in pairs. Question 31. When placing a patient on the weighing scale, the medical assistant should. Here are your options. Option A. Ask the patient to remove all clothing. Option B. Ask the patient to face away from the scale. Option C. Make sure that the scale is calibrated and balanced before actually weighing the patient. Option D. All of the above. The correct answer is option C. Make sure that the scale is calibrated and balanced before actually weighing the patient. Explanation. For an accurate weight measurement, the scale must be properly calibrated and balanced at 0 before the patient steps on it. This ensures that the reading reflects only the patient's weight. Question 32. Dr. Jones closed his medical practice and moved to another state while he had patients under his care. He failed to inform his patients that he was terminating their treatment. What cause of action may be brought against Dr. Jones by his patients? Here are your options. Option A. Breach of contract. Option B. Non-compliance. Option C. Defamation. Option D. Abandonment. The correct answer is option D. Abandonment. Explanation. Abandonment in a medical context occurs when a physician stops caring for a patient without giving reasonable notice or making arrangements for another provider to take over, which is a breach of professional duty. Question 33. Registered Medical Assistant RMA credential is awarded by which certification agency? Here are your options. Option A, AMT. Option B, CMA. Option C, no. Option D, nah. The correct answer is option A, AMT. Explanation. The Registered Medical Assistant, RMA, credential is a professional certification awarded by the American Medical Technologists, AMT, organization. Question 34. The acronym AAMA refers to. Here are your options. Option A. Association of American Medical Assistants. Option B. American Association of Medical Assistants. Option C. American Alliance for Medical Assistants. Option D. American Administration for Medical Assistants. The correct answer is option B. American Association of Medical Assistants. Explanation. The AAMA stands for the American Association of Medical Assistants, which is a professional organization specifically for medical assistants in the United States. Question 35. If a medical assistant defies the doctor and refuses to obey his orders, it is an act of. Here are your options. Option A, prejudice. Option B, sarcasm. Option C, insubordination. Option D, tenacity. The correct answer is option C, insubordination. Explanation. Insubordination is the act of willfully disobeying a direct and legal order from a supervisor or employer. In a medical office, refusing a physician's legitimate instruction is a serious disciplinary matter. Question 36. Putting off pending tasks to a later time, sometimes completing the task right before the deadline is. Here are your options. Option A, proactive. Option B, indolent. Option C, procrastinate. Option D, a negligent. The correct answer is option C, procrastinate. Explanation. Procrastination is the act of delaying or postponing tasks, often until the last possible minute. It can lead to stress and poor work quality in a fast-paced medical environment. Question 37. Which of the following is an example of professional conduct? Here are your options. Option A, coming in a little late but going home at a later time. Option B, assisting fellow workers and expecting praise. Option C, saying no to office politics and gossiping. Option D, getting information about fellow employees and telling the supervisor about the information. The correct answer is option C, saying no to office politics and gossiping. Explanation. Professional conduct involves maintaining focus on patient care and office efficiency while avoiding negative behaviors like gossiping or participating in office politics. Question 38. Two patients arrive at the office simultaneously, one with severe high blood pressure and the other one with a severe headache. Deciding which patient is to be seen by the doctor first is referred to as. Here are your options. Option A, screening. Option B, deprioritizing. Option C, triage. Option D, selecting. The correct answer is option C, triage. Explanation. Triage is the process of determining the priority of patients' treatments based on the severity of their condition. It ensures that those with life-threatening or urgent needs are seen first. Question 39. Which of the following locations offers the most protection to confidential communications? Here are your options. Option A, waiting room. Option B, reception area. Option C, examination room. Option D, cafeteria. The correct answer is option C, examination room. Explanation. The examination room provides a private environment for patients to discuss health concerns with providers, ensuring confidentiality as required by privacy regulations like HIPAA. Question 40. A filing system that consists of a series of 43 file folders including 12 monthly and 31 daily folders. Here are your options. Option A, tickler file. Option B, color coding file. Option C, subject file. Option D, alphanumerical file. The correct answer is option A, tickler file. Explanation. A tickler file is a chronological organization system used as a reminder for tasks to be completed on specific dates. It typically consists of $12 folders for months and $31 folders for days. Question 41. All of the following are rules to be followed when charting except. Here are your options. Option A, chart in black ink. Option B, use of correction fluid. Option C, write in legible handwriting. Option D, if it was not charted it was not done. The correct answer is option B, use of correction fluid. Explanation. The use of correction fluid, like whiteout, is strictly prohibited in medical charts because it obscures the original entry. Errors should be corrected by drawing a single line through the mistake, initialing it, and writing the correct info. Question 42. Which of the following is not one of the C's of charting? Here are your options. Option A, check. Option B, current. Option C, complete. Option D, concise. The correct answer is option A, check. Explanation. The 5 Cs of medical charting usually refer to being clear, concise, complete, contemporaneous, current, and courteous, or coherent. Check is not one of these fundamental principles. Question 43. All of the following should be followed when purging medical records except. Here are your options. Option A, medical records can be destroyed by shredding or burning. Option B, facility should maintain a master list of all records. Option C, Medicare records should be maintained for 10 years. Option D, Medicaid records should be maintained for 5 years. The correct answer is option D, Medicaid records should be maintained for 5 years. Explanation. Medicaid record retention requirements vary by state, but they often must be kept for at least $6 to $10 years. Maintaining them for only $5 years may not meet all legal standards. Question 44. The root word lapar or o means. Here are your options. Option A, chest. Option B, skull. Option C, abdomen. Option D, neck. The correct answer is option C, abdomen. Explanation. In medical terminology, the root lapar or o refers to the abdomen or abdominal wall. For example, a laparoscopy is an examination of the abdominal cavity. Question 45. The transverse plane of the body is also known as the underscore. Here are your options. Option A, frontal plane. Option B, cross-sectional plane. Option C, coronal plane. Option D, sagittal plane. The correct answer is option B, cross-sectional plane. Explanation. The transverse plane divides the body into superior, upper, and inferior, lower, portions. Because it cuts across the body horizontally, it is also called a cross-sectional plane. Question 46. Which of the following is the suffix for to create an opening? Here are your options. Option A, ectomy. Option B, tomy. Option C, stomy. Option D, loy. The correct answer is option C, stomy. Explanation. The suffix stomy refers to the surgical creation of an opening into an organ or between organs, such as a colostomy or a tracheostomy. Question 47. An abnormal curvature of the spine is a disease called. Here are your options. Option A, spina bifida. Option B, scoliosis. Option C, osteomyelitis. Option D, osteomalacia. The correct answer is option B, scoliosis. Explanation. Scoliosis is a medical condition in which a person's spine has an abnormal sideways curve. It is most often diagnosed in adolescents. Question 48. What prefix means of below? Here are your options. Option A, infra dash. Option B, anti dash. Option C, contra dash. Option D, retro dash. The correct answer is option A, infra dash. Explanation. The prefix infra dash means below or beneath. For example, infraorbital means below the eye socket. Question 49. The valves on the right side of the heart are. Here are your options. Option A, tricuspid and mitral valves. Option B, pulmonic and aortic valves. Option C, tricuspid and pulmonic valves. Option D, mitral and aortic valves. The correct answer is option C, tricuspid and pulmonic valves. Explanation. The right side of the heart contains the tricuspid valve, between the right atrium and ventricle, and the pulmonic valve, between the right ventricle and the pulmonary artery. Question 50. The medical term for reduced blood flow is. Here are your options. Option A, infarction. Option B, embolus. Option C, ischemia. Option D, thrombosis. The correct answer is option C, ischemia. Explanation. Ischemia is a restriction in blood supply to tissues, causing a shortage of oxygen that is needed for cellular metabolism. If prolonged, it can lead to an infarction. Question 51. Lifting of the shoulders and turning of the head is controlled by. Here are your options. Option A, cranial nerve 12. Option B, cranial nerve 11. Option C, cranial nerve 10. Option D, cranial nerve 9. The correct answer is option B, cranial nerve 11. Explanation. Cranial nerve $11, also known as the accessory nerve, controls the sternocleidomastoid and trapezius muscles, which are responsible for head turning and shoulder shrugging. Question 52. What is the term for slow breathing? Here are your options. Option A, bradycardia. Option B, bradyarrhythmia. Option C, bradypnea. Option D, bradykinesia. The correct answer is option C, bradypnea. Explanation. Bradypnea is the medical term used to describe an abnormally slow breathing rate. The prefix brady dash means slow, and pnea refers to breathing. Question 53. The following are true statements of the urinary bladder except. Here are your options. Option A. It serves as a temporary reservoir of urine. Option B. It is located in the abdominal cavity. Option C. It is muscular so it can expel the urine. Option D. It is hollow so it can expand when it is filled. The correct answer is option B. It is located in the abdominal cavity. Explanation. The urinary bladder is located in the pelvic cavity, not the abdominal cavity. It is a hollow muscular organ that stores urine until it is excreted. Question 54. What is the procedure to detect cancer in the large intestines? Here are your options. Option A, cholecystectomy. Option B, laparoscopy. Option C, angioplasty. Option D, colonoscopy. The correct answer is option D, colonoscopy. Explanation. A colonoscopy is a procedure where a doctor uses a colonoscope to look inside the rectum and colon. It is primarily used to screen for colon cancer and polyps. Question 55. What is the recommended pulse site that the medical professionals use when doing a routine check of the pulse rate? Here are your options. Option A, radial artery. Option B, carotid artery. Option C, femoral artery. Option D, brachial artery. The correct answer is option A, radial artery. Explanation. The radial artery, located on the thumb side of the wrist, is the most common site used for routine pulse checks because it is easily accessible. Question 56. A 45-year-old was brought to the hospital because of vomiting of blood. The term for this is. Here are your options. Option A, hemoptysis. Option B, epistaxis. Option C, hyperemesis. Option D, hematmesis. The correct answer is option D, hematmesis. Explanation. Hematmesis is the medical term for the vomiting of blood. Hemoptysis is coughing up blood, and epistaxis is a nosebleed. Question 57. Which of the following is not used to clean the site for a blood culture specimen? Here are your options. Option A, iodine. Option B, surgical soap. Option C, Lysol. Option D, alcohol. The correct answer is option C, Lysol. Explanation. Lysol is a household disinfectant and is too harsh for use on human skin. Blood culture sites are cleaned with antiseptics like iodine, alcohol, or chlorhexidine. Question 58. Which of the following blood samples should be placed in ice water? Here are your options. Option A, lead testing. Option B, glucose tolerance test. Option C, arterial blood gases ABG. Option D, blood culture. The correct answer is option C, arterial blood gases ABG. Explanation. Arterial blood gas, ABG, samples must be placed on ice immediately after collection to slow down cellular metabolism, which ensures the gas levels remain accurate until testing. Question 59. The normal bleeding time is. Here are your options. Option A, 2 to 8 minutes. Option B, 10 to 15 minutes. Option C, 20 minutes. Option D, 1 hour. The correct answer is option A, 2 to 8 minutes. Explanation. Bleeding time is a medical test done to assess platelet function. A normal result is typically between $2 and $8 minutes. Question 60. A finger stick is done on the following fingers. Here are your options. Option A, middle and index finger. Option B, the thumb and the middle finger. Option C, small and ring finger. Option D, middle and ring finger. The correct answer is option D, middle and ring finger. Explanation. For capillary puncture, finger stick, the middle or ring finger of the non-dominant hand is usually chosen because they are less sensitive and have more tissue. Question 61. What is the number one complication of venipuncture? Here are your options. Option A, seizure. Option B, hematoma. Option C, fainting. Option D, petechiae. The correct answer is option B, hematoma. Explanation. A hematoma, a bruise caused by blood leaking into the tissue, is the most common complication of venipuncture, often resulting from the needle passing through the vein or insufficient pressure after withdrawal. Question 62. A patient came in complaining of having a burning sensation while urinating. What chemical in the urine would confirm a suspicion that the patient has a urinary tract infection? Here are your options. Option A, ketone. Option B, bilirubin. Option C, blood. Option D, nitrite. The correct answer is option D, nitrite. Explanation. The presence of nitrites in the urine is a strong indicator of a urinary tract infection, UTI, as many bacteria that cause UTIs convert nitrates into nitrites. Question 63. Surgical hand washing is performed in this way. Here are your options. Option A, by scrubbing for 4 minutes. Option B, for 10 minutes using a sterile hand brush. Option C, for 15 minutes with germicidal soap. Option D, for a full 20 minutes. The correct answer is option B, for 10 minutes using a sterile hand brush. Explanation. A standard surgical hand scrub typically takes about $10 minutes and involves using a sterile brush and antimicrobial soap to thoroughly clean the hands and forearms. Question 64. The transplant of animal tissue into a human. Here are your options. Option A, isograft. Option B, heterograft. Option C, homograft. Option D, autograft. The correct answer is option B, heterograft. Explanation. A heterograft, also known as a xenograft, is a tissue graft or organ transplant from a donor of a different species, such as animal tissue, into a human. Question 65. When should the meningococcal vaccine be administered? Here are your options. Option A, age 11. Option B, at birth. Option C, age 21. Option D, age 40. The correct answer is option A, age 11. Explanation. The CDC recommends that children receive the meningococcal conjugate vaccine at age $11 or $12, with a booster shot given at age $16. Question 66. The greeting used in a letter such as "to whom it may concern" is what part of a letter? Here are your options. Option A, complimentary closing. Option B, salutation. Option C, signature. Option D, attention line. The correct answer is option B, salutation. Explanation. The salutation is the formal greeting at the beginning of a letter. "To whom it may concern" is used when the specific recipient's name is unknown. Question 67. An electronic device that makes possible the transmission of data to and from a computer via telephone or other communication lines. Here are your options. Option A, hard drive. Option B, RAM. Option C, URL. Option D, modem. The correct answer is option D, modem. Explanation. A modem, modulator-demodulator, is a hardware device that converts data into a format suitable for transmission over telephone lines or cable systems. Question 68. All of the following are input devices for a computer except. Here are your options. Option A, mouse. Option B, keyboard. Option C, printer. Option D, random access memory. The correct answer is option D, random access memory. Explanation. Mice and keyboards are input devices used to enter data. A printer is an output device, and RAM is internal storage or memory, not an input device. Question 69. Which of the following is not a storage device? Here are your options. Option A, memory stick. Option B, zip drive. Option C, router. Option D, DVD. The correct answer is option C, router. Explanation. A router is a networking device that forwards data packets between computer networks. It is not used for storing data like a flash drive or DVD. Question 70. What reference is used at the end of a letter to list people who will receive a copy of the letter? Here are your options. Option A, Inc. Option B, DH pound. Option C, CC. Option D, yours truly. The correct answer is option C, CC. Explanation. The notation CC, originally standing for carbon copy, is used at the end of a business letter to indicate that a copy of the document is being sent to other people. Question 71. Which of the following devices allow the user to manipulate the cursor? Here are your options. Option A, tab key. Option B, backspace. Option C, Bluetooth. Option D, mouse. The correct answer is option D, mouse. Explanation. The mouse is the primary handheld pointing device used to move and manipulate the cursor on a computer screen. Question 72. Which mail classification includes cards, letters, and parcels that weigh 13 ounces or less? Here are your options. Option A, priority mail. Option B, standard mail. Option C, first class mail. Option D, periodicals mail. The correct answer is option C, first class mail. Explanation. First class mail is the standard service for postcards, letters, and small packages weighing up to $13 ext, ounces, dollar. Question 73. 1 gigabyte is approximately how many bytes? Here are your options. Option A, 1024 bytes. Option B, 1 million bytes. Option C, 1 billion bytes. Option D, 1 trillion bytes. The correct answer is option C, 1 billion bytes. Explanation. In the decimal system, a gigabyte represents $1 billion, $10 bytes. In binary systems, it is slightly more, $10 3, but $1 billion is the standard general definition. Question 74. In a business letter, what margin is commonly used? Here are your options. Option A, half an inch. Option B, 1 inch. Option C, 2 inches. Option D, 3 inches. The correct answer is option B, 1 inch. Explanation. Standard business letters typically use $1 ext, inch, dollar margins on all sides to provide a professional and balanced appearance on the page. Question 75. The substance in the body that is needed for energy. Here are your options. Option A, protein. Option B, fat. Option C, carbohydrate. Option D, minerals. The correct answer is option C, carbohydrate. Explanation. Carbohydrates are the body's primary source of energy. They are broken down into glucose, which the body uses for fuel for its cells and organs. Question 76. If the patient's BMI is 27, what would be the classification of the patient? Here are your options. Option A, overweight. Option B, underweight. Option C, normal weight. Option D, obese. The correct answer is option A, overweight. Explanation. A body mass index, BMI, between $25 and $29.9 is classified as overweight. A BMI of $30 or higher is classified as obese. Question 77. What vitamin deficiency will lead to night blindness? Here are your options. Option A, vitamin B1. Option B, vitamin A. Option C, vitamin D. Option D, vitamin C. The correct answer is option B, vitamin A. Explanation. Vitamin A is essential for maintaining healthy vision, especially in low light. A deficiency can lead to xerophthalmia and night blindness. Question 78. Osteomalacia is caused by a deficiency of. Here are your options. Option A, vitamin B1. Option B, vitamin A. Option C, vitamin D. Option D, vitamin C. The correct answer is option C, vitamin D. Explanation. Osteomalacia is the softening of the bones, typically caused by a severe deficiency of vitamin D, which is necessary for calcium absorption. Question 79. Mrs. Nagel is 6 weeks pregnant. She has a family history of congenital birth defects. She is concerned about neurological diseases during pregnancy. Which vitamin is used in pregnancy to prevent her baby from having spina bifida? Here are your options. Option A, folic acid. Option B, iron. Option C, ascorbic acid. Option D, magnesium. The correct answer is option A, folic acid. Explanation. Folic acid, vitamin B9, is crucial during early pregnancy to help prevent neural tube defects, such as spina bifida, in the developing fetus. Question 80. A 42-year-old male came to the clinic complaining of twitching of the muscles. Sometimes the patient involuntarily jerks for no reason. He said he started experiencing the twitches after he started water therapy and started to urinate frequently. Which mineral most likely is the culprit for his twitching? Here are your options. Option A, manganese. Option B, magnesium. Option C, copper. Option D, zinc. The correct answer is option B, magnesium. Explanation. Magnesium plays a vital role in muscle contraction and nerve signaling. Deficiency, hypomagnesemia, can cause muscle twitches, cramps, and involuntary movements. Question 81. A physician's prescription ordered 120 mgs per day of medication for a patient. The patient is to take 1 or 2 the dose in the morning and 1 or 2 in the evening. The medication comes only in 30 mg tablets. How many tablets will the patient take combined in one day? Here are your options. Option A, 6, option B, 8, option C, 4, option D, 2. The correct answer is option C, 4. Explanation. To find the total tablets per day, divide the total daily dose, $120 ext, mg, dollar, by the strength of each tablet, $30 ext, mg, dollar, which equals $4 tablets, $120 or 30 equals $4. Question 82. Use therapeutically certain medications reduce anxiety in certain stress disorders, relieve insomnia, and aid in pain relief. Which of these would not? Here are your options. Option A, depressants. Option B, barbiturates. Option C, tranquilizers. Option D, hallucinogens. The correct answer is option D, hallucinogens. Explanation. Hallucinogens are substances that alter perception and mood but are not used therapeutically to treat anxiety, insomnia, or for pain relief like the other options. Question 83. Medication when applied to a patch that is affixed to the patient's skin is called. Here are your options. Option A, buccal. Option B, transdermal. Option C, topical ointment. Option D, Manta test. The correct answer is option B, transdermal. Explanation. Transdermal medication delivery involves a patch placed on the skin that slowly releases a controlled amount of medication into the bloodstream over time. Question 84. What is another name for a prefilled syringe? Here are your options. Option A, flange. Option B, insulin syringe. Option C, tuberculin syringe. Option D, cartridge. The correct answer is option D, cartridge. Explanation. A cartridge is a pre-filled container of medication designed to be used with a specific type of reusable syringe or injector device. Question 85. To calculate doses, what is the pediatric method for calculation based on infants younger than 2 years old? Here are your options. Option A, Clark's rule. Option B, nomogram. Option C, Fried's rule. Option D, Young's rule. The correct answer is option C, Fried's rule. Explanation. Fried's rule is a formula used to calculate pediatric dosages for infants younger than 2 years old, based on the child's age in months. Question 86. Before you prepare any medication to be administered to a patient, you should. Here are your options. Option A, ask the patient how he or she would like to receive the medication. Option B, ask if the patient is allergic to any medication. Option C, ascertain the patient's comfort level and ability to receive medication. Option D, check the medication 3 times before administering it. The correct answer is option B, ask if the patient is allergic to any medication. Explanation. The most critical safety step before administering medication is to verify whether the patient has any known allergies to avoid a potentially life-threatening reaction. Question 87. Your patient has been placed on 2 different medications. Your patient is not improving and the physician discovered that one drug decreased the effect of the other. What is this drug interaction called? Here are your options. Option A, potentiation. Option B, antagonism. Option C, side effects. Option D, pharmacokinetics. The correct answer is option B, antagonism. Explanation. Antagonism is a type of drug interaction where one drug blocks or reduces the effect of another drug when they are taken together. Question 88. The study of drug action as it moves in the body. Here are your options. Option A, pharmacodynamics. Option B, pharmacokinetics. Option C, pharmacology. Option D, cumulative effect. The correct answer is option B, pharmacokinetics. Explanation. Pharmacokinetics is the study of how a drug is absorbed, distributed, metabolized, and excreted, ADME, as it moves through the body. Question 89. Which of the following is a prophylactic drug? Here are your options. Option A, corticosteroids. Option B, compazine. Option C, amoxicillin. Option D, hepatitis B vaccine. The correct answer is option D, hepatitis B vaccine. Explanation. A prophylactic drug or treatment is intended to prevent a disease from occurring. Vaccines, like the hepatitis B vaccine, are classic examples of prophylaxis. Question 90. Your patient is displaying signs and symptoms of chronic anxiety. Which type of drug might be appropriate? Here are your options. Option A, diazepam. Option B, Ritalin. Option C, testosterone. Option D, amoxicillin. The correct answer is option A, diazepam. Explanation. Diazepam, Valium, is a benzodiazepine often prescribed to treat anxiety disorders, muscle spasms, and seizures. Question 91. When we justify our thoughts or actions whether it is right or wrong. Here are your options. Option A, rationalization. Option B, sublimation. Option C, feedback. Option D, displacement. The correct answer is option A, rationalization. Explanation. Rationalization is a defense mechanism in which controversial behaviors or feelings are justified and explained in a seemingly rational or logical manner to avoid the true explanation. Question 92. According to Sigmund Freud, a child can be fixated at this psychosexual stage if he or she becomes obsessed with control, perfection, and cleanliness. Here are your options. Option A, oral. Option B, anal. Option C, phallic. Option D, latency. The correct answer is option B, anal. Explanation. In Freudian theory, the anal stage focuses on toilet training and control. Fixation at this stage can lead to an anal retentive personality characterized by obsession with order and cleanliness. Question 93. Which of the following is not an effective communication strategy for the visually impaired? Here are your options. Option A, alerting the patient before touching him. Option B, increase your tone so he can understand you better. Option C, describe surroundings and locations of structures. Option D, allowing the patient to touch instruments and things when appropriate. The correct answer is option B, increase your tone so he can understand you better. Explanation. Visual impairment does not mean the patient has a hearing loss. Increasing your tone, shouting, is unnecessary and can be condescending or confusing. Question 94. What legislation prohibits discrimination against people with disabilities in employment, transportation, public accommodation, communications, and governmental activities? Here are your options. Option A, CDC. Option B, OSHA. Option C, ADA. Option D, CLIA. The correct answer is option C, ADA. Explanation. The Americans with Disabilities Act, ADA, is a civil rights law that prohibits discrimination against individuals with disabilities in all areas of public life. Question 95. In scheduling procedures, the chief complaint of the patient assists the medical assistant in the following except. Here are your options. Option A, identify the reason for the consult. Option B, identify the urgency of the patient visit. Option C, identify the diagnosis of the patient. Option D, identify if the facility is equipped to handle the patient visit. The correct answer is option C, identify the diagnosis of the patient. Explanation. The chief complaint helps determine the purpose and urgency of the visit, but the actual diagnosis is made by the physician after an examination and testing. Question 96. When medical supplies are being inventoried, the medical assistant should. Here are your options. Option A, have a list of all supplies and equipment. Option B, organize the supplies in different storage containers with labels. Option C, secure the supplies in cabinets or storage rooms. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Proper inventory management involves maintaining comprehensive lists, organizing supplies clearly with labels, and securing them to prevent loss or damage. Question 97. Screening calls is important because it allows the office to underscore. Here are your options. Option A, avoid patients who are not emergency. Option B, triage patients according to priority. Option C. Avoid disruptions to the appointment schedule. Option D. Prevent walk-ins. The correct answer is option B. Triage patients according to priority. Explanation. Screening calls allows the medical office to triage patient needs, ensuring that urgent cases are handled appropriately while maintaining the flow of scheduled appointments. Question 98. Which of the following is not a type of business formation for a medical practice? Here are your options. Option A. Partnership. Option B. Sole proprietorship. Option C. Corporation. Option D. Liability ownership. The correct answer is option D. Liability ownership. Explanation. Common business structures include sole proprietorships, partnerships, and corporations. Liability ownership is not a recognized legal term for a business formation. Question 99. SOAP chart refers to. Here are your options. Option A. Subjective Objective Administer Proposal. Option B. Subject Opportunity Access Program. Option C. Subjective Objective Assessment Plan. Option D. Systems Operations Assessment Project. The correct answer is option C. Subjective Objective Assessment Plan. Explanation. SOAP is an acronym for Subjective, Objective, Assessment, and Plan, which is a widely used method of documentation for healthcare providers to record patient information. Question 100. If you have a new patient appointment, which of the following should not be asked from the patient? Here are your options. Option A. Social Security number. Option B. Birth date. Option C. Religion. Option D. Insurance information. The correct answer is option C. Religion. Explanation. While demographic and insurance information is necessary for billing and identification, a patient's religion is generally not required for administrative purposes and should not be a mandatory question.